네, 그럼 지금부터 오후 세션 시작하도록 하겠습니다. 네, 오후 세션 첫 번째 발표는 케냐 상공회의소의 닥터 에릭 루토 부회장님께서 케냐 내셔널 챔버 오브 커머스 앤 인더스트리라는 주제로 발표 시작하겠습니다. 네, 부회장님 무대로 모시도록 하겠습니다. 네, 큰 박수 부탁드립니다.
Okay, thank you very much. As you have heard, my name is Dr. Rutto Erick from Kenya, National Chamber of Commerce Vice President. I'm also in the healthcare industry, where I run a network of healthcare facilities, hospitals and clinics in Kenya, 6 in total, named Real Group of Hospitals. Before I proceed, I would like to really appreciate the Korea Health Industry Development Institute, our great friend, the Executive Director of SDG Youth, Kim, who has been a great friend for Kenya and SDG Youth Kenya. Equally also, my predecessors were here. I was pleasantly surprised to find my senior, Dr. Osewe Patrick, who is my countrymate, who is with Asian Development Bank. And thank you for representing us here very well and in this part of the world. So basically is that coming from the private sector and also having participated in several public procurement tenders in Kenya, is that I'll present, my presentation will be based on 3 objectives. Objective number 1 is a demand for healthcare commodities, technology, and services in Kenya, and what is driving that demand. Secondly, I'll be able to give you the landscape of healthcare in Kenya. And then finally, which is extremely straightforward, and I hope you'll not be disappointed, is a public procurement in Kenya, which is highly standardized, highly open, and transparent, and I'll be able to give you how to participate in public procurement in Kenya. I was hearing people pressing the red. Is it the red one? No, the one in the center. Oh, the one in the center. Okay, there we go. Okay, thank you. So Kenya is in the eastern part of Africa, and it is the economic, logistical, and innovation hub, just like South Korea in this part of East Asia. Together with its growing economy, the health sector in Kenya is on trajectory, and numerous plans are set towards universal healthcare. And I would like to, for the Korean Development Institute to note this, is that currently there is a project by our Kenyan government to offer universal healthcare to all its citizens. So I want to invite you, one, in healthcare financing, how you've been able to have a complete social health insurance that is both contributory from employed workers and the informal sector. We want to learn from you, and it's a very important area where you can be able to contribute. Kenya is a model country in Africa, especially in healthcare and ICT, and therefore it would be very good for you to enter through Kenya to the eastern part of Africa. The total estimated market for healthcare is $259 billion, which I think is a sizable market for Korean companies. And as per the estimation of Fitch, the Kenya healthcare industry is worth $4 billion. Africa is a huge population, 1.3 billion, as compared to Asia. But something that I need you to note is that by 2100, the African population will just be 10% less than what you're having here. What does that mean? The growth rate is high in terms of population. There is a new emerging market, and the right time to enter is now. Definitely you can be able to design your healthcare technology and products towards that young population growth. Africa has only 11% of the population, but 24% of the disease burden. What does it mean? It means the demand for healthcare is higher, but that is not what I want you to concentrate on, especially the professor of economics. I want you to concentrate on primary healthcare and preventive measures for healthcare. That is where the opportunity is for Korean companies, and we can be able to do a joint collaboration for proposals to African governments and through the African Union. I'm sure it is a product that can sell. Just to compare the population, we are almost similar. Korea has 51 million. In Kenya now we have 53 million people. Approximately 75% of that population is less than 35 years, so it's majorly young and youth. The population growth is high, around 2.5 to 3.0%. For you to be able to design your healthcare products and technologies, it's good for you to appreciate what is the disease burden. And in terms of majority, approximately 60% is in communicable diseases, that is malaria, HIV, and TB. We have maternal, perinatal, and nutritional conditions that contribute quite significantly. And the reason why I'm mentioning that is that these are heavily funded by UN agencies such as the Global Fund, WHO, and you can be able to participate in that kind of tendering within the country. Also picking up very fast is the non-communicable diseases. And in my next slide, you'll be able to see that although the burden is in communicable diseases, where we spend a lot of money is non-communicable diseases. The top 5 causes of mortality of disease is HIV, cancer, lower respiratory tract infections, diarrheal diseases, and early childhood conditions. The causes of death, as you can see there, is HIV/AIDS, 29%, perinatal conditions, 9%, lower respiratory tract, 8%, cancer, 7%, tuberculosis, 6%, diarrheal disease, 5%, malaria, 5%, cerebrovascular disease, 3%, ischemic heart disease, 3%, road traffic accidents, 2%, and violence, 2%. I've just put that slide for you to note that the Kenyan government has a policy to establish 10 cancer centers in the region. We are having approximately, the incidence of cancer is approximately 39,000 per year. We have managed to establish 4 cancer centers. So 4 Korean companies who are in that sector, from diagnostics to treatment. You can be able to come and do a proposal for government to establish the other remaining 6. And I'm sure the lists of number will be growing. In terms of what we spend as Kenya, and that is what I was telling you, that you don't just look at the disease burden, but in terms of the budget, you will see that the non-communicable diseases are taking the largest healthcare expenditure in Kenya. Cardiovascular disease is top. Peptic ulcer disease, that is the disease of the stomach, painkillers or analgesics, drugs that are used for control of diabetes, which I saw a colleague here from WHO Ukraine was able to say that the leading product that they're procuring for Ukraine was insulin. So we are quite spending a lot. And the other, you can be able to see the top 10 in terms of selected therapeutic lines for 2019. That's approximately 3 years ago. In Kenya, if you're looking at setting up your distribution channel, you'll be able to get experts, especially in terms of scientific marketing. If you're looking at putting up industries, you'll be able to get the human resource locally. Of course, there's shortage of healthcare staff in the whole world, but fairly, Kenya in that region or in Africa has a well-developed health human resource, so that you even have a doctor who is at African Development Bank from Kenya. I think that one understates the quality of human resource that you have from Kenya. Yes, there's a new government in Kenya, and is going to develop policy, especially in universal healthcare. And I heard that our president will be coming to Korea. So maybe for Kihidi, kindly, when that information is public, kindly have a good presentation, because one of the 4 main agendas of the current government is in universal healthcare. So what I want you to do, propose methods of healthcare financing, development of local factories, technologies and equipping of hospitals. They want to equip approximately 47 level 5 hospitals, those are tertiary level hospitals across the country. You could be able to participate in that. And this one, you can have a special way of tendering, whereby you come with a concept, you propose for government, and if it is cost effective, you can be able to do that. In addition to having a joint ventures with the local companies, for investments, especially in the healthcare sector, there are several opportunities for you to invest in terms of tax breaks in the special economic zones and in the export processing zones. And why I'm mentioning this is that Kenya is in a region called Common Market for South and Eastern African countries with a population of approximately 500 million people. Kenya, in that part, the origin of pharmaceutical drugs is that it occupies 50%. So if you are looking at expanding your manufacturing base beyond Korea and the region, because there are technically other technologies and pharmaceutical products that you cannot efficiently produce from Korea, but you could have Korean companies coming to Kenya to be able to do local manufacturing. In addition to that, let me go slightly back, but maybe I'll be able to remember. You can also participate in public-private partnerships, whereby currently Kenya government has formed a national public body for purposes of manufacturing vaccines. It's called BioVax, is inviting expression of interest to see how they can be able to develop vaccine manufacturing within Kenya. So the Kenyan government will provide you with the land, basic infrastructure, and what you call bulk procurement for government. And we can be able to you can be able to participate during that process. Of course, the market structure in Kenya is that the private sector is leading, occupies approximately 43%. I want you to look at the last commercial private sector. I would say, let's say commercial private sector to government, 39%. Faith-based and non-governmental is 17%. So as you come to Kenya, is that over 50% of healthcare is provided by non-state actors. So this is not a sector that you can afford to miss because it occupies a very large part in terms of healthcare provision. Through government, and I say this is now how you can participate. We have the Kenya Medical Supplies Agency Authority. This is a government entity that is the only entity that can be able to procure commodities and pharmaceutical products and equipment in government. It is usually in two forms, either open national tender for local distributors and local manufacturers, and open international tender. So you can be able to participate. It's usually a very open process. The guidelines and the requirements for those products are there. Then for the other one, which is a faith-based, there is something called Mission for Essential Drugs and Supplies. It's a huge procuring entity in Kenya. We could be able to introduce you to them. Already we came to them with them last 4 months in June this year. Yes, the demand for products, as I told you, we have the East African community and the common market for East and South Africa, among others, which Kenya occupies 50% of the pharma industry. I think I've talked about the external market and how we are able to participate within that region. Funding for healthcare is, of course, there is a Kenya government exchequer. Secondly, there are global bodies such as a Global Fund. We have the United States USAID Vaccine Global Alliance Institute that is able to procure medicines. The other way you can be able to participate is through public-private procurement. The Ministry of Health Kenya provides approximately 300 billion, which is approximately $3 billion US for public sector healthcare in Kenya. Of course, approximately 35% of that goes into commodities and pharmaceutical products. Why would you want to set up your factory in Kenya? Is that in terms of ease of doing business, Kenya was ranked 56 out of 190 countries in 2020, which was a great improvement from 2014 where we were number 80. So there is ease of doing business in Kenya. And for you to be able to enter into market, as a manufacturer, you can set up a local manufacturing firm. As an exporter, partner with local industry wholesalers and distributors in Kenya, which we can be able to provide you with that market intelligence. Partner with local manufacturer service providers through joint ventures, buying equity on existing companies or having mergers. Set up retail pharmacy stores, clinics, hospitals, and diagnostic centers within the country. Healthcare products registration process. Before you participate in public procurement, we have an entity called Pharmacy and Poisons Board, which regulates all pharmaceutical products, non-pharmaceutical products, and healthcare technology. And the registration process is put there. I'll be able to, I think the team will be able to share this slide, and you can be able to see these are usually standard processes for registering healthcare products and technologies in Kenya. Procurement process for healthcare products in public, I think I had mentioned. Kenya Medical Supplies Agency, which is already is a national agency that deals with public procurement, and MEDS, which is procures for the private sector. In terms of overview of the procurement process in Kenya, it's very simple. I know you're interested on the left one, which is a public procurement. So essential drugs and essential equipment are procured by the government agency, which is either Ministry of Health or the Kenya Medical Supplies Agency, KEMSA, and the National Lab Services Store. So there you can be able to participate both national tender and international tenders. Some of the tenders would require you to have a local partner, especially in terms of service and service parts and servicing of the equipment in that line. Of course, the private, private and non-private, private for commercial purposes is very open. You'll be able to see several practitioners in that line, and you can be able to get your products into the Kenyan market. Okay, let me go back. I don't know which one. Yes, that one. So some of the opportunities that you can be able to do is mobile clinics. There is a demand for that. Hospital construction. That is a turnkey project from civil works to equipping and to operating. There's a big opportunity that you can be able to have in Kenya. Investment in primary healthcare in terms of preventive, you can be able to participate in that. Technology supply, public-private partnerships, and cancer care, which I've mentioned. But just to note is that you say that you are very advanced in ICT. I would like to have a Korean company, especially in central medical records management, because the current policy is that the Kenya government wants to establish a centralized medical records management, whereby both the private sector and the public sector will be able to view patient records. And more so, not on the software part, but on the last mile. So it's a discussion that we could have, and it's a live opportunity. We can be able to do an expression of interest to the Ministry of Health. If you want now to see, those are some of the links for purposes of public procurement. Of course, you have to have met the regulatory requirements, which you have to be registered by our Pharmacy and Poisons Board. How to export to Kenya through KenTrade, simplify process of exports. Issues of taxes, you can be able to do that. If you want to get all government services, eCitizen is a gateway to all government. You can get it online. Kenya Medical Supplies Agency Authority, that is one which is procuring drugs and commodities and technologies to the private sector, to the public sector. Kenya Bureau of Standards, especially in terms of equipment. Those are the ones who will be able to look at your technologies and equipment for the country. You can be able to check what are some of the requirements. And for the private sector, where I come from, Kenya National Chamber of Commerce and Industry, you can check the website and the services we offer. Kenya Association of Manufacturers, if you want to partner with local manufacturers. And National Hospital Insurance Fund. This is the one which provides healthcare financing through employee contributions, which the government wants to expand into non-employee contributions to the informal sector. So thank you very much for listening to me. And I shall be available both here and back in Kenya if you want any linkages in the private sector, any linkages to the government in terms of the Ministry of Health, and to the highest level to the presidency, we can be able to provide that link. Thank you very much.
큰 박수 부탁드리겠습니다. 네, 두 번째 발표로 넘어가도록 하겠습니다. 두 번째 발표는 우간다 보건부의 Dr. Joseph Okware 보건청장님께서 Public Healthcare Procurement Project from Uganda's Governmental Official이라는 주제로 발표 시작하겠습니다. 무대 위로 모시겠습니다. 네, 여러분 큰 박수 부탁드리겠습니다.
Thank you very much. Good afternoon. My name's again Joseph Okware from Minister of Health of Republic of Uganda. I'm happy to speak after my brother, Dr. Rutto. Uganda and Kenya are neighbors, and we are pretty much the same. So what we are speaking are basically similar. I'm also very happy for the invitation to come and share with this fora what is available, opportunities available in Uganda. Oh. This one. Okay, so that is just a map to locate where Uganda is. I don't know whether you can spot it at the center. That is Uganda in East Africa, for those who may not know exactly where the country is. It's in eastern part of Africa, and it's commonly referred to as the Pearl of Africa. And that's the blown out map of Africa with the good neighbors of Sudan, Kenya, Democratic Republic of Congo, Tanzania, and Rwanda. Uganda is a landlocked country in East Africa with those borders, and it comes with a lot of opportunities for investment, as you will get to see. Our population is slightly less than Kenya and less than South Korea. Our population currently is about 41 or 42 million people, but with a very high population growth rate of over 3%. We are predominantly young population. About 49% of our population is under 15 years old, and literacy rate of 76%. And of particular interest to Koreans, we need a lot of support for health insurance. Our health insurance coverage is only 4%, and we're currently working on a national health insurance bill. So we have a lot to learn from South Korea. That is the president of Uganda, the smiling old gentleman. For you to note, he has been he has been president of Uganda since 1986, and is still going on. In a few years to come, he will make about 40 years as president of Uganda. And he has done very well. Yes, that is him and me a few years ago when we were doing some good work in Uganda. The ministry top leadership, I wanted to show you just in case you happen to meet them in any international meeting. It's predominantly led by ladies. The top leadership is ladies only. The three ministers, as you can see, are ladies. The top are political appointees, and then the bottom, these are technical people, and that is me there. But the politicians are all ladies. Now, I thought before I go to procurement, I needed to just give you the status of these diseases that are disturbing the globe today. Uganda, we have COVID-19, still like any other country, but we also now have Ebola. We don't have monkeypox yet. When I reached the airport the other day in South Korea, in Seoul, I was hunted down by the surveillance there, as a Professor Kim said this morning, and they wanted to track me. So they gave me this surveillance form in Korea and the chart to be able to monitor my temperature while I'm here, and I was very happy with that level of surveillance in South Korea, because in Uganda, as you'll see, we unfortunately have currently an outbreak of Ebola, which has lasted close to a month now. Ebola is not a new disease. It's a viral disease, as we all know, mainly affecting us in Africa. It is caused by a group of viruses within the genus of Ebola virus. The symptoms are there for you to reflect on, but often we see patients with fever, aches, pains, fatigue, sore throat, loss of appetite, and hemorrhagic tendencies and bleeding and bruising among the patients. That is, by the time I left Uganda, that was the status. Sorry. Oh, where am I going? Yes, we had had the total of 126 cases of Ebola, and unfortunately, by that time, we had lost 32. They may have increased by now. And of particular interest, I wanted to show you that among the people that we have lost, we have also lost our health workers, and may their souls rest in peace. We had about 13 that had been infected, and about half of them had succumbed to the disease. COVID-19 is going down in Uganda, like most of the countries, I think. And when I left, we didn't have any case admitted for COVID-19, but by then we had cumulatively lost close to about 3,632 deaths registered due to COVID in Uganda. Monkeypox, we have not recorded any monkeypox case in Uganda, and indeed, I think for most of the African countries other than Central African Republic and Cameroon. I don't think there's any other country that has recorded a case of monkeypox by then. Okay, so now turning to procurement procedures and guidelines. Just like Kenya has given us an insight, for Uganda, we have also quite improved on this. We have those websites available. We have a Ugandan procurement portal that you can log on to see what is required for you and the opportunities that are available. We have an authority in Uganda, the PPDA, Public Procurement and Disposable Assets Authority. That is an authority of government that sort of oversees procurement processes across the board for the country. And I want to share that it has zero tolerance against corruption and fraud, and this should motivate the companies represented here to be able to willingly participate in the procurement processes in Uganda. The bidding process used in Uganda by PDDA is transparent and is a fair procedure. With so many stakeholders playing a part in the processes, and we believe that the outcome of these processes are quite good so far. We have a good legal framework that is supporting this process in the country. We have an Act of Parliament that this is anchored on. We have regulations. We have a lot of guidelines that are guiding this and controlling the procurement process in the country. There are so many types of procurements. When you go to the website, you can read about this. There are about 6 of them: open tendering, restricted tendering, request for proposals, 2-stage tendering, request for quotations, single sourcing. All that is available for us. So any of this could be used in the country for procurement. The institutional framework for public procurement is also very simple. It's not, at least not as complicated as the one of UNDP. It's quite straightforward. So it's very easy to penetrate, and you will get successful. The stages of procurement are standard and simplified from the planning up to the time of contract award and signature. It's not a complex process. So whether you're a foreign bidder or domestic or local bidder, it's easy to go through these processes, and it's quite transparent. The details about what is involved in each of these processes or the stages are available in the website that are there. However, there are some eligibility requirements, which again are not really far from what is globally standard. You need to have a legal capacity to enter into a contract. You fulfill the obligations to pay taxes. And as a foreign provider, where a required document is not provided in the country of your origin, you must submit an alternative document or statement affirming that the document is not available in the country. So these are really simple. You shouldn't be insolvent in receivership or bankrupt, but these are standard requirements for eligibility. Having a trading license, certificate of incorporation, these are really standard, but that's what the authority requires for you to participate and be eligible to participate in it. So where does the problem normally come from? Many of the bidders, especially the local ones, get eliminated because they don't prepare well. And of course, there is stiff competition from local companies and even from foreign firms. There is also not having enough knowledge about the procurement laws of the country. So the team, your team, should be able to read up the appropriate laws and work within those laws. And of course, I don't expect many forgeries from foreign companies. This is really for the local ones. And these are standard. Just to share with you a picture of what's going on so far. I think this is for 2021, how we procured in terms of value and in terms of number. This was last year. Of the total procurements that were done by Uganda, we had 68.1% taken by local bidders and about 32% by foreign bidders. So there is success. It doesn't mean that when you bid from as a foreign firm, the chances are very small. No, there's a door for you to enter. But in terms of value, you can see it is still small from the foreign angle. So we want to grow, especially the foreign participation in terms of numbers of contracts, but also in terms of value of the contracts. Now, coming to procurement of health products, just like Kenya, we have specialized for organizations, authorities that handle these procurements of health products, equipment and supplies. So for the public facilities, we have Uganda National Medical Stores, commonly known as NMS, and they have a website that I will share. That's their store that they're currently building, and that's the website. You can log onto that website and interact with them on what they are requiring for the future, what is currently being required, and the processes. It would be good that you take that website and interact with that gentleman. So they procure the bulk of the health products for the public health facilities. Then the other sister organization that procures for the non-public ones, especially the faith-based, is the Joint Medical Stores. And I will share also the website. They do about maybe 40% of the health products that they procure for the country. So as you can see, Uganda currently is having about 7,000 health facilities, and 45% of these are public facilities, and 14% are faith-based, and then 40% are private. So the JMS actually can enable you to access both the faith-based market, but also the private, because a lot of the private clinics and hospitals buy their medicines and equipment from joint medical stores. So the next few slides simply show what the government of Uganda is doing in form of tax incentives and exemptions for these health products. All that array of equipment are tax exempted, This information is again available on the website that I've given you, but things like chemical analyzers, ophthalmic instruments, dental equipment, ultrasound machinery, syringes, wheelchairs, all these, there is no VAT, and the duty tax is exempted. Ambulance, motorboat ambulances, vehicle ambulances, mama kits, all that. And this is the diagrammatic slides showing the equipment that do not attract tax if you import or you export to Uganda. Okay, so all that already exempted from taxes under a certain schedule in Uganda. So finally, I would like to advise all the companies represented here that you should, in the process of accessing the market in Uganda, to label the products in Korean, but also in English, a bit of English, simple English that can be understood by everyone, so that even at tendering process, you are understood. I can assure you that Uganda is friendly and open, and as you can see, SDG Youth has already reached us there. The lady there is the Permanent Secretary of Ministry of Health, and another lady here, I think, is from KIDI, having a very warm discussion with the Minister of Health on how to access products from Korea. That was early this month. And that is finally a message from the Minister of Health, the Permanent Secretary. She says she would want to welcome and thank all the Korean friends and companies. And as I said, she also says that you should label your products in simple English for everybody to understand. And above all, she's encouraging the companies to establish branches or plants in Uganda, and also assuring you of the tax incentives, and also including land and good electricity and water tariffs if you make a decision to invest in Uganda. Thank you very much for your kind attention. Thank you.
네, 고맙습니다. 두 번째 조셉 오쿼레 보건청장님의 발표였습니다. 네, 세 번째 발표 이어갑니다. 다음은 나이지리아 UN 헤비타트 내셔널 세크리테리엇의 우조 아이파니 추쿠 코스타스 책임님께서 Addressing Health Needs in Urban Cities, Challenges and the Way Forward라는 주제로 발표 시작하시겠습니다.
Good day, distinguished audience. First and foremost, I would crave your indulgence for us to have a 1-minute silence for the incident that happened here in Korea. Please, can we all stand up? Can we all stand up, please? For the incident that happened in Korea, can we just have a minute silent for those young people? Thank you very much. Thank you. You can sit down. I started with this because I represent the young people. And having worked with young people for over 15 years, I see myself as a global ambassador for young people. Now, when I got the invitation to be here, I looked at the invitation with two mixed feelings. Because one, I'm not a doctor, I'm not a medical personnel, and secondly, I am not in the procurement department. So I find the invitation very worrisome, to the point that I didn't proceed to procure my visa to be here because I was still having the mixed feelings. But my very good friend, whom we met for the very first time yesterday, but we have been talking online, the founder of the SDG, Mr. Kim, has been on my neck that I have to come to Korea. Not until on Thursday, around 3 p.m., that I approached my government and I told them I've made up my mind to go to Korea. And they used the instrument of government to submit my passport to the Korea embassy on Thursday. And on Friday, the embassy called me that my visa is ready. And when I went to pick the visa, the Korea ambassador told me, you have put me under pressure, that your government officials from foreign affairs and the presidency called me that you must issue this man's visa to travel. That is not done for you to get a Korean visa in less than 24 hours. So I see myself as being privileged to have that kind of government support. When I came in here, I listened to all the presentation thus far. One thing that gave me confidence that the reason why I'm here will definitely open opportunity, not only for my country, but for also the participating companies that are here. And that, of course, I took from the presentation of Professor Manki Kim, who said that there are two factors that drive procurement, which are local partnership to reduce cost and to make product available. Then you said the second point, which is where I think I have edge, is the political will. And you talk about government patronage. So having made this background, I would want to proceed quickly. Don't mind my presentation. I've told you I'm not in the medical field. I am not a procurement officer, but I've told you where my strength lies. And I believe that will be very helpful to us. I come from a country called Nigeria. It's in the West Africa, and we have a very large population of about 250 million population. And within this population, we have young people between the age of 18 and 35, making up to 60% of that population. In Africa, Nigeria has the largest economy you can think of, either in manufacturing, in pharmaceutical, and all of that. So it's a population that's a very large economy that can be leveraged on. And we are bordered by Benin Republic, Niger Republic, Cameroon, Chad. And we have 374 multicultural and linguistic language in our country. We are actually blessed with a lot of young talent. Like if you come to Africa, there's what they call my big brother, Dr. Patrick, was just telling me that we have Nollywood. There's our entertainment industry. It's doing well in Africa. That courtesy of the young people. Now, from what I represent in the UN Habitat, it's majorly on the young people. What are the challenges facing young people in the cities? So that's my portfolio, and that is where I'll try to make my presentation to. Now, urbanization in Nigeria is a rapid becoming an urban city. with a result of multitude of push and pull factors. This has generated, of course, urban health crisis among cities and city dwellers, notably the urban poor. The pace of urbanization is unprecedented, with cities such as Lagos, which is the commercial hub of Nigeria, is having a growth of 5.8% annually. The problems of urbanization in Nigeria is mainly demographic. Like I have said, the population is young and youthful driven. Then this has created a whole lot of urban health crisis and great magnitude. You can see the graph there. As far back as 1931, we have 27% of growth. Just the last one there is 1991, and we have a growth of 339, making it an average of 40% high. So that has also that has taken a huge toll into the urban health crisis in Nigeria. And when you look at it, we have the factors and features that generates this urban health crisis. One, the environment, the poor water supply. Then we have urban settlements. We have sanitation issues. We have transportation issues. We have air pollution, agriculture, of course, then urban health services, and of course, communicable and non-communicable diseases. So these are features for Nigerian urban cities. Then there have been attempts to address the health challenge in Nigeria. That, of course, the government is not sitting back, having noted that annually we have about 20,000 Nigerians that goes to India for medical health care. That becomes a very concern for the government. And a recent UNDP report shows that preventable and treatable infection diseases such as malaria, which is one of our major issues in our country, diarrhea, measles, HIV and AIDS accounts for more than 70% of estimated 1 million under 5 deaths in Nigeria. There are also other obstacles to addressing health challenges in Nigeria. And one of the major obstacles include ineffective use of available resources, which is one of the major factors really affecting us in Nigeria. Then there are also other multiple interest diseases burden in diverse population, which requires equal balance, prevention, and care. So far, there have been government efforts in addressing health challenge in Nigeria. And a couple of the efforts are developing new policies aimed at achieving all-inclusive healthcare delivery system, acquisition of new equipments and technology, then strategy for partnership with private sectors, development partners and individuals, and of course, government calling for interventions here and there. So these are efforts governments have put in place, and the responses so far from these government efforts can be categorized into two phases. The call for intervention, private organizations, development partners, individuals, and the corporate experts in healthcare come up with diverse intervention mechanism and ranging from innovation products and services. So far, there have been a lot of inroad in having government made that call. There are a lot of partners, a lot of development partners, even from the UN, the UNDP, and the UN WHO. These are agencies in Nigeria that have been charged with a whole lot of proposals and programs in Nigeria in addressing our health challenges. But however, there's still room for more collaboration and interventions. There are procedures that is required for intervention. And of course, like my brothers from Uganda and Kenya mentioned. All over the world, every country have their procedures to allow foreign partners to support either in medical or non-medical affairs. So first and foremost, there is need to identify the area of intervention because that's key. Then you establish a local partner or local presence, someone who, or a company or an individual who can be able to do all the formal registration. Like he said, in Uganda, we also have it in Nigeria. The register with the Corporate Affairs Commission, that's the government agency that is charged with registration. Then you have a detailed proposal for what you want to do. You attach all relevant documents and all of that, and proof of competence, whereby the capacity you are bringing on board, that of the local and that of the expatriates, will be well explicit in the proposal. Then, of course, we have the Public Procurement Act of Nigeria, which is online. The process is there online. It gives a provision for regulation activities in Nigeria. And the bidding is open competitive bidding. The criteria for evaluation of the bid and award of contracts differ depending on what is being procured and the procurement procedure adopted. With regards to goods and works, and you look at Section 33 of our Public Procurement Act requires that a successful bid will be that submitted the lowest cost bidder, unless the procuring entity can show good grounds derived from the provisions of the PPA as to why it not select the bid. So these are standard regulations that are in place. But generally, these are just the general requirements that is needed for any company to make an inroads. First, which is the first thing, you have to register. You have your Corporate Affairs Commission. That's the first you have to do. Then evidence of payment of tax for the last 3 years. But as a foreign partner, you might not be required to provide evidence of tax because you have not started operation in Nigeria. So all you need to do is to get a local partner who share the same vision with you. You leverage on the local partner tax payment to make your bidding. Then, of course, the comprehensive proposal profile of the company is needed, both your international as foreign partners and local companies. So these are the standard general requirements that is needed for you to do bidding in Nigeria. So similarly, these are also the standard. Then the same standard is just listed down here. Then let me go to, in conclusion, I want to share quickly what happened just about 2 months ago. My very good friend, Kim, got in touch with me and told me about a company from South Korea here, Shirin. And I remember vividly, in the UN Habitat, we have a program which is convened every 2 years. It's called World Urban Forum. It's every 2 years. We take it from one region to another. The last one was just held in Poland. And Shirin, being a Korea company, was in that event organized by the UN, and they made a presentation of their product, which is fire extinguisher and some security equipment. And they got a standing ovation because their product is very innovative, and which, of course, every country would want to have such product in their company. So Kim got in touch with me and told me about them. I said, okay, fine. Just send me a profile of what you do and let's see. So having taken a look of their product, I found out it's something that can actually have a huge market in Nigeria. And I approached the government as usual, and I got all the approval. and we did sign an MOU with them, and I'm expecting them to come to Nigeria by November 26. We have agreed? Yeah. So they are coming to Nigeria 26th of November to do presentation to the government. So why I'm saying this is that if you can identify area where you have strength and area that, of course, we don't have that strength in Nigeria, you can leverage on the patronage, like Prof said, that government patronage is key. So you can leverage on our platform, you can leverage on our access to government to have whatever products you want to bring to Nigeria. We can give you that leverage. Then, and of course, Kim, there's something we've been discussing, and I think if that is done, it will help as an outcome of this conference. He came up with an idea, we call it SDG Youth Global Business Alliance. It's all about getting the Korea companies who profile, like Dr. Patrick said, there's need to have the directory of these companies, what they do, their products, and all of that. So if we have it, it gives us easy access to have that connect and be able to create an avenue for them to come to our country. Then finally, I want to also say that as far as the country where I'm from, Nigeria, is concerned, we don't have any problem because some of us, we are well grounded in the country. The ambassador here is very open. Is somebody, if he knows you are coming from us, then you have easy access. I've already booked appointment. I'm having meeting with the ambassador and the Nigerian embassy here with Kim on the 2nd. So I've told him I'm coming with the team. And for those who are interested to also come to Nigeria, you can join us in that visit. I'll do the introduction. If there's anything you need from our country, we are open. We have access to such delivery. Then I think my presentation so far, I think this is what I have to present to you. And I look forward to greater partnership. And thank you all.
고맙습니다. 책임있게 감사드리면서 다음 발표 이어가도록 하겠습니다. 이번 4번째 발표까지 마무리한 이후에 5번째, 6번째 발표는 영상 발표입니다. 네, 다음은 스리랑카 트레이드 유니언 릴레이션스의 사만 라은나띠아 실바 국장님께서 Public Healthcare Procurement Projects from Sri Lanka's Governmental Official이라는 주제로 발표 시작하겠습니다. 네, 국장님 무대 위로 모십니다.
Very good afternoon to all. Ayubowan, meaning long life in our language. Dr. Dorin Rotao, Emergency Officer, WHO Ukraine. Dr. Patrick Osivi, Chief of the Health Sector Group, Asian Development Bank. Mr. Hung Kim, Director General, Social Infrastructure Development, Asian Infrastructure Investment Bank. Professor Dr. Tahmina Shirin, Director General, Institute of Epidemiology, Disease Control and Research, Ministry of Health and the Family Welfare, Republic of Bangladesh. IEDCR. Dr. John Norris, Chairman, Safety and Prosperity. Mr. Uzoh Costas, Country Coordinator, United Nations Habitat Youth Program, Nigeria. Dr. Erick Rutto, Chamber Vice President, Kenya National Chamber of Commerce and Industry. Dr. Joseph Okware, Director Health Services, Ministry of Health, Uganda. Mr. Juyong Kim, founder SDG Youth, Excellencies, honorable guests, distinguished delegates, colleagues, ladies and gentlemen. I am privileged and honored to have this opportunity not only as an individual but as a nation. We are proud to be here representing the Sri Lankan government and the health sector. Let me begin with a small introduction and some basic information about the country. Earlier, Sri Lanka was classified as a middle range country, and according to the Central Bank Report 2021 and Annual Report of the Ministry of Finance 2021, its population is 22.156 million. The country is governed by an executive president, a board of cabinet, and the parliament, and the governing power has been distributed among 9 provincial councils. The country unit is Sri Lankan rupees, and the American dollar is the most widely used international currency unit. According to Census and Statistics Department report of the Central Bank of Sri Lanka and annual report of Ministry of Finance, Sri Lanka, the national income of the country was American dollar millions 7,326 in 2021, and the national expenditure was American dollar millions 17,708. Around 200 billion is allocated from the national budget for the health sector. From the annual budgeting grants, around 65 billion is allocated for essential drugs. Of the requirement, 20% is made by local suppliers and the remaining 80% comes from foreign suppliers. Now I am going to turn your attention to the current situation in Sri Lanka. The Sri Lankan economy has collapsed due to the wrong political decisions and economic management, and the political balance is also in crisis. During the last 2 years, inflation has increased from 15% to 70%, according to the National Consumer Price Index in September 2022. Food inflation is at 85.8%. The price of essential foods and drugs has gone up by 300%, and a scarcity of essential foods and drugs has also been reported. The cost of all the products and services has increased to 400% from 100%. Around 600,000 people have lost their daily basis jobs, and nearly 200,000 has lost their permanent jobs, as per the reports published in recent times. A severe shortage of fuel and gas prevailed in the country for several months, which resulted in people waiting in long queues for days. According to the recent central bank report, the government foreign reserves were reduced from $4.2 billion to $1.3 billion. The people of Sri Lanka started to protect against this situation, and as a result, the Prime Minister and the government resigned initially, and the president stepped down from his position afterwards. After this resigning, a new president was selected, and with the participation of many parties, he established a government. At present, as a country, we are implementing many actions to manage the economy and political crisis by incorporating good planning strategies. The following are the actions: establishing limitations of the consumptions and import of luxuries, obtaining foreign loans and grants to solve the shortage problems in fuel, gas, essential food and fertilizers, and imposing limitations in the overuse of fuel, restructuring the non-profitable institutions, introducing new taxes and increasing tariffs to increase the government revenue. Discussions with the IMF are underway to gain an emergency loan with staff level agreement, reforming the tourism industry and making arrangement to increase remittances, making agreement with Japan, India and Singapore on investment and trade, restructuring of foreign loan grants. We have implemented several political reforms to overcome the current crisis situation in the country. As for the request made by the President, the amendment of the 22nd Constitutional Order to limit the power and authority of the Executive President and to disseminate the power to the Prime Minister and to the Parliament, gaining Cabinet approval to amend the Anti-Terrorism Act. In response to the suggestion made by the Geneva Human Rights Commission, as a country, it has agreed upon the appointment of a local mechanism, truth-seek mechanism, to investigate the violation of human rights. Release of 3 people who were sentenced by the court during the civil war according to the President's pardon. Cabinet approval has been obtained to reduce the number of members in local government institutions from 8,000 to 4,000, and the needed actions are underway. Implementation of a strategy to allow citizens to participate in governance. To overcome the crisis situation in which Sri Lanka finds itself, we expect the helping hands of the international community to be extended towards us. For the rapid succession of these measures, we need the cooperation of South Korea and the international community, as cooperation we expect. Humanitarian needs as drugs and essential food provisions for needy. Direct foreign investments in the country. I take this opportunity to celebrate that we have provided mechanism, possible opportunities for foreign investors to invest in Sri Lanka with 100% transparent procedures through Board of Investment, BOI, where investors will get tax relief, land and other facilities from the government and continued support from the government to secure investment done. Lucrative investment opportunities and attractive RIOs are seen in the field of tourism, health, education, apparel and power and energy. Loan grants from international monetary institutions. Opportunities to solve the human rights problems through a local mechanism, a truth-seeking mechanism. Job opportunities for semi-skills and skills unemployed youth in foreign. I take this opportunity to thank South Korean government for the generosity of providing employment for Sri Lankan youth for the last 2 decades and hope this will continue in this hour of need. We highly appreciate the opportunity provided for Sri Lanka and we expect all to join hands with us to overcome the crisis and build up the nation once again. Wishing a great day ahead that may Triple Gem bless you all. Thank you.
네, 고맙습니다. 국장님의 발표였습니다. 네, 다음 5번째, 6번째 강연은 영상 발표로 대체하도록 하겠습니다. 먼저 다음 발표는 IEDCR Ministry of Health and the Family Welfare, Republic of Bangladesh라는 주제로 Prof. 타미나 시린 교수님께서 IEDCR and Healthcare Procurement in Bangladesh라는 주제로 발표를 시작하시겠습니다. 현장 참석이 어려운 관계로 영상 발표로 대체하도록 하겠습니다.
Good morning, good afternoon. This is Professor Tahmina Shirin from Bangladesh. I would like to thank you for inviting me in this forum to describe our activity. Actually, I am working in an institute which is known as the Institute of Epidemiology, Disease Control and Research. It is a mandated institute by Ministry of Health. For the disease outbreak investigation and disease surveillance in the country. Besides this, we have programs on field epidemiology training program in 3 tiers. That is the field epidemiology training program, advanced, intermediate, and frontline. And we also provide the training in the healthcare facilities, the people who are working in the healthcare facilities, and we also do the research. Actually, this institute was established in 1976 and as a malaria institute, then it is converted into IEDCR, and in 2007 it is designated as National Influenza Center. So our institute is the focal institute for these sites like the National Influenza Center, Global Health Security, One Health Secretariat, International Health Regulation, Foodborne Emergency and Response, and Global Disease Detection Center for US CDC. These are we have the collaboration with these universities and global organization. You can see it here. And this is actually our organogram. We are under Ministry of Health and Family Welfare. We have these departments like the epidemiology, biostatistics, medical social science, and the yellow mark departments are the laboratory that are situated at IEDCR, that is the medical entomology, microbiology, virology, parasitology, and zoonosis. We have 4 objectives, or the 4 pillars on which we are working. I have already described this. That is the surveillance, outbreak investigation, research, and training. As we are conducting the disease outbreaks, surveillance in disease outbreak and disease surveillance in Bangladesh. So these are the diseases on which we have the surveillance platform in Bangladesh. And I have already mentioned that we also conduct the outbreak investigation. So you can see the numbers of outbreaks that happened in Bangladesh, and here you can see the frequency of outbreaks since 2017 to 2022. So these numbers of outbreak, usually we investigate and respond every year. So there are some snapshots on the outbreak investigation, and actually this outbreak investigation is conducted through PHEOC, that is Public Health Emergency Operations Center, which is situated at IEDCR, and we have 3 tiers through which we conduct the outbreak investigation. That is the NRRT, that means a National Rapid Response Team, down to that the District Rapid Response Team, and at the field level, this is the Upazila Rapid Response Team. So we work together when we do the or conduct the outbreak investigation. We actually take help from DRRT and URRT, and our IEDCR team is belong to NRRT. And during the outbreak investigation, we have multi-sectoral approach. When suppose if there is an outbreak of zoonotic origin, then we involve the people from animal health as well as the people from the wildlife. So I have already mentioned that we always practice the One Health activities. So it starts in 2008, the One Health Bangladesh, and then we have several events that we did under this One Health umbrella. And here you can see the activity that we did. And every 2 years we do the international conference on One Health, and we have also One Health event-based dashboard, data visualization dashboard that we just prepared, and we are still working on it, where the data from the human sector, data from the animal sector, as well as the data from the wildlife will be visualized. We have done the human part, and now they are incorporating their data into the common dashboard, through which we can make actually a early warning system. That's our goal. So this is a framework of One Health activity in Bangladesh. We have, top of all, we have interministerial steering committee on One Health, which is chaired by the Honorable Minister of Health and Family Welfare, and other ministers from different ministries. They are the co-chair of this committee. Down to that, we have another committee that is headed by the Director General of Health Services, and other Director General from other departments. They are the co-chair, and down to that, there is One Health Secretariat, which is situated at IEDCR, and the director of IEDCR is the chair of this One Health Secretariat. Actually, the responsibility of One Health Secretariat is to coordinate the activities under One Health in Bangladesh. So the way we when we do the outbreak investigation, we involve all these departments when it is needed. So here you can see our Nipah outbreak. Actually, in every year we have 1 or 2 Nipah outbreak. So when we go for the Nipah outbreak, we actually involve the other people from wildlife. So here you can see the pictures on it. And this is also the same thing. We have the laboratories, like I have already mentioned. There are 5 laboratories: the virology, microbiology, zoonosis, entomology, and parasitology. Besides this, we have a field lab at Cox's Bazar Medical College, which we developed during the outbreak during the diphtheria outbreak among the FDMNs. So here is some snapshot on the laboratories that we have at IEDCR. This is the NGS platform of IEDCR. Now the workforce development and the training program. We have actually a long course that is 2 years course for FETP Advanced and the short courses on FETP Intermediate, which is for 9 months, and Hospital Epidemiology, which is for 4 months, Frontline FETP for 2 months, and Clinical Epidemiology for 4 weeks. And beside this, we have 1 to 3 days training on different emerging and re-emerging diseases, on the outbreak investigation, on IPC, on the disease surveillance, and also hands-on training on the laboratory activities. So I don't want to go into detail. These are the description of the courses, long courses that we have at IEDCR. These are the short courses. And these are the research activity that is, some of them are ongoing, some of them are at the end, so that we are doing at IEDCR. So this is another list of research activity at IEDCR. These are some publications on different topic like the Nipah virus infection, the National Action Plan for National Influenza Center, then other, you can see other documents like the SOPs. And this is on the biosafety, biosecurity guideline and SOP, and also a handbook on public health emergency operations center. And besides this, we also made some communication material regarding the WASH, regarding the anthrax and the Nipah for the community. Now, how we responded in the COVID-19 pandemic. Actually, IEDCR was the first institute who worked on this COVID-19 SARS-CoV-2, like the active case search, contact tracing, and laboratory investigation. And we identified the first cases in Bangladesh, which was in8th March 2020. And then later on, the government took over the responsibility, and they developed more than 100 facilities for detection of SARS-CoV-2 in the country. But before that, we were the only institute. And our FETP fellow, that is the Field Epidemiology Training Program fellow, and the graduate, they are actually actively involved in this outbreak investigation, I mean the COVID-19 outbreak investigation. And they were involved in different activities like active case search, contact tracing, managing the quarantine activities, and they also involved in the developing the guidelines and the other documents, and they also involved in the dashboard development during COVID-19 pandemic. So here you can see the dates, the different time period of the pandemic and their activity during the pandemic. At the beginning, they actually responded to the, I'm talking about the FETP fellows and the graduates. They were responding the hotlines number. They received the call from the community regarding this COVID-19 pandemic. They were involved in the quarantine activity. They followed up the travelers after 14 days of their arrival. They also involved in the guideline development, dashboard development, and they are here you can see they are doing the case investigation and contract tracing. Here they also implemented the zonal containment, and they reported weekly to the district managers at some time points of this pandemic. And they also trained the people in the throughout the country for active case search and contact tracing. And they also involved in the research activity. And you can see different time points with their activities during this pandemic. Here they also investigated the district with high positivity during this pandemic. They were also involved in the vaccination regarding the if there is any adverse effect, or if there is we get a cluster of people who develop the adverse effect following vaccination thing. So these are the COVID-19 related surveillance that is conducted by IEDCR, the genomic surveillance, the multi-system inflammatory syndrome among the children. They also, we have also surveillance for the SARS-CoV-2 specific antibody following vaccination. And here you can see the one publication which was published on the website of Tahmina regarding the containment activity, which was done by the one FETP fellow. You can also see his picture on this publication. And we, at the beginning, when we didn't get the positive case in Bangladesh, at that time, actually we arranged the regular press briefing to alert the people. And after confirmation of first case, then we did the subsequent activity that I have already mentioned. And this is the website of IEDCR, where we developed a separate window for COVID-19 updates. So actually IEDCR leading the public health from the front. The only institute has the capacity for the outbreak investigation and response, and every year a number of training program organized by to strengthen the capacity, and every year the trained field epidemiologists are added to the public health sector, and we are also involved in workforce development by conducting the long course as well as the short courses. So these are the success of IEDCR. We identified the first case of dengue virus during 2000 and Nipah virus in 2001, human anthrax in 2008. First chikungunya case was identified by IEDCR in 2008, and first case of avian influenza virus in human was identified in 2008. And then we also established first molecular laboratory in the government sector. That was also in 2008. The first case of H1N1 09 pandemic was identified by IEDCR. The first case of avian influenza, that is H9 and N2, was identified in 2011. And we conducted the chikungunya outbreak that happened in 2017. The IEDCR was the only institute for the molecular detection of chikungunya in Bangladesh, and we confirmed the diphtheria outbreak in the FDMS in 2018, and we also confirmed the SARS-CoV-2 first case in Bangladesh on 8th March 2020. So there are some challenges as well as the scopes, like the sustainable technical support for workforce development, capacity building for PHEOC, and capacity building for early disease detection and response. So thank you all for patience hearing. Thanks.
네, 고맙습니다. 타흐미나 슈린 교수님의 발표였습니다. 이번 발표는 역시나 영상 발표로 대체하도록 하겠습니다. 이번 영상 발표까지 마무리한 이후에 10분간 쉬는 시간 갖도록 하겠습니다. 다음은 Safely2Prosperity의 Dr. 존 노리스 회장님께서 Communicable Diseases Control and Procurement Opportunity in the U.S.라는 주제로 발표 시작하도록 하겠습니다. 마찬가지로 현장 참석이 어려운 관계로 영상으로 함께 보시겠습니다.
Dr. John Norris is a former chief operating officer at the U.S. FDA, and he also co-led the agency's last major reform. He's a former Harvard faculty member and taught courses on health law, regulatory affairs, IT, and risk management. Today, Dr. Norris is going to be talking about keys to an effective infectious disease risk management and related U.S. business opportunities. So now I'd like to welcome Dr. John Norris.
Thanks, John, for your kind introduction. Where we're headed, we're about to do, and certainly need to do, what I call infectious disease risk management system reform. I've been involved in a lot of reforms before at the FDA and at Harvard and and in other settings, this is the most important reform I've ever been involved in. The reason this reform is so important is it involves recreating part of our US and global critical infrastructure. That's a term that's going to come up a lot in my presentation today. US FDA and Harvard have been two of my homes. I've been involved in teaching healthcare reform, and also I did, as John mentioned, co-led the last major internal reform of the FDA. So reform is part of my nature. This is all about reforming the critical infrastructure of the US and the globe as it relates to infectious diseases. Again, this is going to be a very brief review. I'm summarizing in 15 minutes what took 40 years to assemble. We all know that there's been gross mismanagement of a vicious enemy called COVID-19 and its variants. Now, I don't blame anybody for the gross mismanagement. We didn't have the right tools in place to do it right. We have been using the 1918 version of the tools for the critical infrastructure. And therefore, I believe we're going to find that many of the deaths, more than a million in the US and many millions around the world, many of them were avoidable, perhaps as many as 60%. We don't know because we haven't had the clinical, studies necessary to determine that yet, but it's going to be determined at some point. Now, why is this so important, this critical infrastructure reform? Well, we only saw one form of attack by this COVID-19 and its variants. One form. There are many forms of attack. There is this gentle, I would call it relatively gentle nature attack. There can be much worse attacks by nature, including, for example, the inclusion of COVID-19 and the flu infection in someone. But there's also beyond that. What we have seen before in history is gross incompetence by researchers, gross negligence, where they release a bug into the world. And there's also other things such as either terrorist attacks or global wars. And I believe, and I've said this before publicly, that the next global war, the next world war is going to be biologic. Makes so much sense to do it that way. You'd kill a lot fewer people if you do the right kind of biologic. You certainly kill fewer people on your side if you do it that way. Plus, you don't have to rebuild the cities and the towns and all the structures for food and water that exist. But there is clearly, because of that, the multiple directions, the 1918 general format for the critical infrastructure, there's a need for change, and there's a need for change right now. What are our other vulnerabilities? Well, food can disappear if you don't have people available to create it. Water can disappear if nobody's operating the dams. There are several, air can be polluted if we don't control those factors. So having people healthy and available to run those features of our society is very critical. So healthcare, or health and healthcare, are a critical pillar of our success. What's wrong with now? Well, absence of advanced digital involvement. We run everything today except infectious disease risk management by computer, by advanced computing, sometimes AI, but we don't do it here. And the system we have is what I call a top-down approach, the 1918 approach. It's a top-down approach. It involves senior government officials deciding what needs to be done. I advocate a bottom-up approach, where the CEOs of companies and the heads of households decide what needs to be done. Now, that doesn't disallow the people who were running the countries and running the states from being involved, they have a very important role. And it just doesn't give them the entire role. It transfers to people at the base of the triangle, the power and the responsibility for controlling things. Now, I asked the question, one per corporation? Absolutely. Every CEO needs a tool, a reformed tool, a tool for digitally managing the vaccines and the tests and the therapeutics in a very smart way. And without those tools, they can't do it. There's chaos. Think of managing 10,000 employees' needs in a chaos like a war if you don't have tools to do it, electronic tools, software tools to do it. It's a fool's errand. One per household, yeah, more expensive. I see that maybe employers will want to give their at-home environments also to be part of the coverage, but they might not, and that's okay. But they have to cover their employees at work or the work stops. And we need the work to continue in a crisis. We saw the big mistakes that were made in closing countries and closing companies and closing schools. In many cases, more harm was done than good. We need to have a future where what I call a double sanctuary approach, where people are safe at work and safe at home so they can be productive and continue to work. What is it we're adding? Well, we're adding to the critical infrastructure. We're adding something, a set of tools that will enable these homes and companies to schools to continue to function, not go out of business for a month, 6 months, a year. You know, in a war, they could be out of function for years. So you need to take that into account. You also have to take into account, and I'll talk about this a little more later, that these homes and companies will need supplies during times of crisis. So you have to protect the suppliers of the inputs and the raw materials that companies need to function. You need to protect the food supply for households can continue to function. You need to protect the water supply. So what's required is something that I call the following. Our system is broken because of the absence of an advanced digital distributed, I'll talk more about that, insightful, thoughtful, comprehensive, I'll talk about that a little more too, ever-growing, ever-refining, cost-effective, I'll talk about that a little bit too, and in many ways, resilient. You gotta, when you bring on new things in critical infrastructure, you need to make sure they don't destroy other things. Therefore, they must be resilient. Now, absent a 24/7, 365, all the time, all day, all night approach and comprehensive oversight and specific actions to go with it, you're not going to have a system that works. We want to make everything better. We want to save the 60% of people who died perhaps avoidably, okay? So you need to do it in a very sophisticated way. You also need, as I mentioned before, a hardened, let me just move this here, a hardened and distributed manufacturing and supply system. Right now, you get all your vaccines from 2 places, one in the US, or 3 places, sorry, 2 in the US and 1 in Europe. That isn't good. That isn't good. You need to have, one of these vaccine plants basically in every state, or you have to have the Amazon approach where you can deliver in a day's time the vaccines and the distributed manufacturing and supply systems that you need. Warehousing. And you know something? The hardest hit from a bug like this turned out to be the manufacturers and the food processors and the warehousers and the distributors of products, because they have to be close and typically in confined spaces. Now, I'm talking about a very complex three-leg problem. You can't get away from that. But you also have to provide significant incentives and proper funding. The next world war, as I said, almost certainly, I believe, will be a biologic war. So you have to prepare for the extreme case. And bottom line, we're not prepared. We're not prepared. We are using obsolete approaches and we're not prepared. Let me go to the, I want to make sure you understand this. This is the most recent Johns Hopkins COVID spread sheet. This bug hasn't gone away. Germany had just in the last 28 days, something like 2 million infections and 2,800 deaths from COVID. Last 28 days. Can you imagine? That's something like 5 jumbo jets crashing in Germany. Everybody would have heard about that if that happened. Nobody's heard about the 2,800 deaths in Germany from COVID. It isn't on the minds of our press. It isn't on the minds of our citizens. That's a big, big mistake. We're going to get caught with our pants down. There are other countries on this list that are notable. The US has had enormous numbers of deaths still. And these numbers are going to go up to 5,000 a month very quickly once the fall proceeds and you have the flu and you have the COVID together. South Korea has also had 1,000 deaths in the last 28 days. Nobody's thinking in these terms. We need to do it. Now let me talk a little bit about the solution. Obviously, the solution is the opposite of the problem. So I won't get into this in much detail. You do provide a bottom-up approach instead of a top-down approach. You mostly add to the existing infrastructure. Our vaccines, our tests, our therapies are great. They're coming along nicely. Can you imagine developing something in months that normally takes 10 years? Pfizer, J&J, Moderna, they ought to be applauded. Now, are they going to be perfect? Are we going to have some loose ends? And eventually, yes. They're not going to be perfect. To get perfect or near perfect, you got to study it for 10 years. But we got it in time to save a lot of lives if they were used properly. We need the funding. The funding is necessary if we're going to do this right. Every company's got to step up to the plate and provide their own funding. But for the distribution of systems, we need the government to step up to the plate too. Are these goals too high? I ask myself I don't think they are. I think we can accomplish them. As I said, my plans have been 40 years in the making. I think they're pretty good. Resilient. Engineers and software developers have been taught for 100 years, as long as engineers have been around, that efficiency is the holy grail. We have to say no. Resiliency is the holy grail now. We need to have resilient systems that, in fact, in peacetime can work and in war times can work. Distributed. Well, I want to distribute them, as I said, down to the corporate and the household level. What am I going to do in a wartime if I can't manage my plant because my employees are getting sick? I have to have the tool right there. I can't rely on some other leader far off to try to determine the micro aspects of my company. Same with my household. Who's gonna really run the safety of my household but me? I am talking also about national and globally holistic. I want this to be an effort like we had around nuclear war. This is biologic war in the sense I'm talking about. We need to defeat these bugs, and we need to defeat whoever brings those bugs to us. I think the U.S. allies, and especially South Korea and some others that would be participating in this kind of conference can do it together. This is a thing that, solutions are already ready. I've developed a solution with the help of John Covender, who you met earlier. I've worked on this for 40 years, particularly the last 4 years, where I've worked on mostly on this most of my time. It's ready to roll. Preparedness is overdue, far overdue, decades overdue. We need to do it now. I have, as I mentioned, a 4-level strategic action plan. Governments, particularly federal governments, state governments, corporations and schools, and then households. That's the way to do it. Double sanctuary at corporations and at homes. That's the way to do it. When I say sanctuary, disease-free sanctuaries where I can go home and I can go to work without getting infected. And if I get infected, I can go home and not kill people at home and vice versa. The effective actions, spread, oversight, and prevention, mitigation, and control. You have to have all of those. If you don't have 24/7 oversight, if you don't have 24/7 actions for prevention, if you don't have 24/7 actions for mitigation once an outbreak occurs, and if you don't control it, it's just like a fire. You have to be there and do something quickly. I often talk about the system that we've developed as a system similar to the fire safety programs that are ubiquitous around the world. I expect our system over the next decade to become ubiquitous around the world. Every company in the world needs something like this, just like every company in the world needs a fire safety program. Now, a couple of more things. There's an overlooked goal, and that is governments can disappear. People have to protect their government. Companies have to protect their government. The government needs to have economics in its favor. Companies have to keep running. Households have to keep running to support their government, the common good. These tools also need data protection. We need privacy. There's a lot of private information that goes into running these systems. We also need analytics data protection. A hacker could do damage if you didn't have it. Now, the system we've developed has both of those protections in space. Can cell phones be involved? They have to be involved. Any cell phone service can go out too. We understand that. But to do it best, you need to have cell phones involved so you can alarm, alert, and report employees in the field, people at home. That's the best system. I advocate two things beyond that. What I call fully handheld antigen test devices. They've come on like gangbusters. I've worked on those for 30 years. In the last year, 2 years, they've come on like gangbusters because they're needed. Fully handheld means you don't need a clinical lab. Clinical labs could be knocked out in a war too. Let's face it. Clinical labs are expensive. Employers may not want to pay for lab tests. Lab tests are about 3 to 5 times, maybe 10 times more expensive than handheld devices. If you want a PCR test, which is a little better and more useful in some ways than antigen testing, you may want to use both, contrasting use. PCR tests now can be partly handheld. You take all the sample at home or at work and you ship it electronically to a remote lab. In the case of one of the products we're using, one of the best tests in the world, they're based in Australia. And US companies can use it just by using the cell phone. Now, as I said, maybe cell phones will get knocked off. Maybe internet will get knocked off. So I want to have at least fully handheld antigen tests available to companies at home. I'm not a big fan of fully lab-based tests. I think please, manufacturers of fully land-based tests, forgive me. I think we've moved beyond that for a handful, at least, of infectious diseases. We're not going to move beyond it for everyone, we want to move beyond it for the most important diseases like COVID, like the flu, which is coming on, interestingly, monkeypox, like polio, which is coming on, interesting. You know, CVS Health has 24 vaccines and 24 tests available. They identify 24 most important infectious diseases. I want to cover at least 10 of those with my type of approach, fully handheld if we can get it. Now, the government might have to subsidize it. The FDA might have to extend its leniency in approving handheld devices. Let me give you a quick summary of how and where you and your country and your companies can be involved if you want to be. Now, the example I'm using is the US. It might not be the best example either for being involved in Asia and Europe or Africa, but probably it is in that direction. It may not be the best direction for them coming into the US. The government is pretty tough to work with, but I have other ideas, and I'll tell you how we're proceeding. The thing you want to keep in mind is there's several different product categories that you can ship to the United States. You can invent products or invent, IP, intellectual value. You can develop products. You can manufacture products. You can warehouse products. You can sell products. You can distribute products. You can manufacture vaccines, tests, therapies. You can invent them. You can get them approved by the FDA, which is not an easy task, but you can do that in certain circumstances here in the United States right now. And I brought a lot of companies into the US, a lot of some Asian, some European. It's not easy, but it's doable. You can also bring the components into the United States. You can bring raw materials in the United States. You can bring services in the United States. All of this is possible. And, excuse me one second. There is a possibility that you should start with the US in all these categories. I just am saying to you, it's a tough path. You're better going to Asian countries, and we can help you think through that. You're better going to European countries. You're better going to African countries right now. Even though the United States was the hardest hit, over 1 million deaths, there is not an easy thing to do to work with the federal government. Now, I recommend to you other paths, particularly paths of going to US corporations and selling your products into those corporations. Now, you can do what you want to do, but what I would do, and what I am doing, and John Covender is doing, is we're creating relationships, partnerships with resellers outgoing for us, but also we're creating incoming relationships with sellers of products, resellers of products into us. We're creating a platform on which they can use our technology to make themselves more sellable. And we also help sell their products. So, bringing in an Asian product into the United States is not that tough if you work through a reseller or a platform and you're going after corporations rather than the government. Now, there's an exception there. There's a couple of government agencies you can go after, and that's the military industrial complex organizations. They are always eager to find a better source and a better product because they have a very tough mission and they have to be prepared. They have to have backups. If a company that they are depending on goes down, they have to have a backup for that. And in a war, you're gonna have casualties of companies. You're gonna have casualties of the critical mass of employees needed to run a company. Now, in the United States, there's also right now, and I think there will be for years, it's supposed to be temporary, of an exception. It's called for medical tests to be approved by the FDA very quickly under a exception to what's called 510K, and that is called emergency use authorization. Tests that would have taken a lot more time, probably clinical trials, expensive, $1 million, but also other times of energy to get approved and on the market quickly, were approved and gotten on the market quickly. Over 400 tests for COVID were approved in just 6 months. So that's a very, very good effort by the FDA, which I'm very fond of because I was the COO of at one time. And I know the people there work very hard. And in fact, some of the smart people at the FDA are the smartest people I ever worked with. How can you apply for an exception? Well, we can, as a friendly gesture, tell you how. Let me just see here. I think the best path from now, as I said, is to go after corporations in the US if you want to go after them. Perhaps a few government agencies too. The best tool is through a reseller digital platform. Now, we happen to have one, but we're hoping there will be competitors someday. I found that there's a joke here in the United States, a one-lawyer town, the lawyer goes bankrupt. In a two-lawyer town, both lawyers make a fortune, okay? And they make a big difference. So we're all about making a big difference. At the same time, we make a fair return on our investment. Again, sales to the government, I wouldn't go after that. The apparent overall best path, at least in the near term, as I say, is to go after particularly corporations and schools. Those are the targets. My conclusion, go for the gold and go for making a difference. They can come hand in hand. Make a big difference by saving lives. We've committed ourselves to soon saving 1 million lives worldwide. That will be, for us, a token or a sign of our success. That's all for now. Thanks. The end.
네, 큰 박수 부탁드리겠습니다. 이렇게 해서 6번째 강연까지 마무리가 되었습니다. 다음은 10분간 쉬는 시간을 갖도록 하겠습니다. 네, 현재 시간 3시 43분입니다. 10분간 쉬는 시간을 가지고 55분까지 쉬도록 하겠습니다. 55분까지 쉬는 시간을 가진 이후에 세 번째 세션 시작하도록 하겠습니다.